I'm Dennis Queen. I live in South Manchester. I'm a disabled person. I have complex impairments. Wanted to make a short video about COVID-19 and its impact in as few words as I can, which is not easy for me. So on a personal level, I've been very lucky because I'm in independent living and I've spent many years setting up a good support package, a home that I can access, where I have a nice little garden space. I'm in a ground floor flat with my family. And I locked down early before the whole country was in lockdown. So the last time I went anywhere that isn't a medical appointment was the 3rd of March, which was when my wife adopted our twins. And it was an amazing day. And unfortunately, from then, I have stayed home in order to avoid COVID-19. And I've done that successfully. However, we're now in July 2020. And apart from one trip to a physio and one trip to the optician, I haven't really been anywhere. It's hard, but not that hard, as I was stuck at home for many years before I had accessible housing and a decent support package. So I'm not used to living this way. What's different is my whole family's at home with me, which is kind of lovely in one way, but obviously awful for them to be in lockdown. Usually I've been the only one stuck home. But in the last sort of 6 or 7 years, I've had the equipment I need as well as better housing. And I've actually been able to get out often, at least several times a week, because I have the support, the accessible housing and the equipment to do so. So it's been a bit of a change going back to being stuck in. But it's not that bad for me. I'm quite lucky because I'm not on my own. And I'm fairly well supported. The downside for me has been that I've had to recruit twice for care staff during lockdown, which has been an interesting experience. So the first member of staff just abandoned their job before lockdown because of anxiety about COVID-19. And then the second one, several weeks in, we realised was stealing my medication. So they had to go, and we've had to involve the police, and all that's been really busy. But that's kind of the worst stuff, as well as a little bit of issues with food supply early on. I was fortunate that I was able to get supermarket delivery once a week now from Tesco, which has made all the difference. And their priority delivery system and the other large supermarkets has been very helpful, although for some of us it's a lot more expensive, as I would usually shop at Aldi round the corner. So we're paying quite a lot more for our shopping at the moment. So I kind of hope we'd save money because we're staying home a lot, but some of the things are costing a bit more. The harder issue for me has been how it affects our whole community. Early in lockdown, I was worried about how it was going to affect people in institutions and what we would do. And I mean everywhere, from prisons to care homes, to nursing homes, to adult institutions, to anywhere where disabled people are locked away against their will, including ATUs and mental health institutions. And then they brought in the COVID bill, which said that we could have our right to care taken away unless it was life-saving, which would mean most of us who rely on support for daily living could lose it if our local authorities decide to enact that because they need the money due to COVID. That would, for I think hundreds of thousands of us, probably remove our ability to live independently immediately, including mine. And I've used my care package to raise 3 children in independence in my own flat. So I'm from a very lucky generation of disabled people that from early adulthood I've been able to fight and access that support that I needed. If we lose it now, we've got a long way to fight back to get that care and support again. So everyone's really worried about the potential consequences of this. And then very soon after, this is still in March, they brought in guidance from the National Institute for Clinical Excellence, and they called it a frailty score. And they made it clear that anyone scoring, so on a score between 1 to 10, if you were a 6 and above, you wouldn't automatically get life-saving treatment and ICU treatment in hospital. It doesn't mean you wouldn't get it at all, but what it means is you won't automatically be put through for it when you need it. And that's based on a belief that some of us would be less likely to survive, although the frailty score itself weirdly seems to focus actually on how much support you need, not your chances of surviving COVID. So that piece of information, together with the COVID bill, then left us in a very worrying position, because it meant everyone's care can be removed, including people in institutions. It meant that many people could be refused healthcare they needed. Then GPs started ringing in some areas and asking patients if they would like to forfeit treatment and write a advance directive saying that they don't want to be resuscitated. That period of time was terrifying even for me, knowing that I wouldn't qualify automatically for treatment, but also knowing that as a white, well-spoken person with a feisty family, that I would still at least get given a chance. The worry I was having was for everyone who might not have anyone to help them fight to hospital, people in institutions who might get sick en masse, and what would happen. And it was really obvious before it started what would happen. And it feels like only now anyone is mentioning much the figures of people who have died in institutions because of COVID. Patients were being put back in institutions after when they hadn't recovered yet from COVID and they were still infectious. And yet, no, we didn't use our Nightingale Hospital here in Manchester. Now, the news we're hearing at the moment here is that people have not been asked to sign advance directives, and people here have not been refused treatment, although we want to hear if they have. It looks like Manchester has stood by its usual high standards that we would expect around fairness of healthcare and around care and support. But really, we won't know for a while exactly what's happened to everyone, although early evidence is showing that those of us in independent living with support packages like mine have been much less likely to become ill and much less likely to have other problems arise. Because there's another problem, and that's that because the health service has basically ground to a halt on everything, almost everything except COVID and the emergencies, it means that millions of people have gone without treatments, surgeries, consultations, therapy that they needed, that they were already getting or they were waiting to get at hospital. So some were already in treatment, some were already waiting, and now the people who would have been treated during this time, there's going to be such a backlog that I can't see it. New referrals are going to be, you'd be lucky if you're seen within a year. We don't know yet when those appointments are going to reopen. And that's affected me quite badly too. But in comparison to others, I feel, again, like I've been quite lucky, because we know that the figures of people who have died from things unrelated to COVID are very high. And again, I think it will be a while before we know what those figures are. The figures of elders that have died have been disproportionate. The figures of people with learning difficulties have died, we know, are disproportionate, and we still can't get accurate figures. We're trying to. So it feels to those of us in politicised quarters like the government has used this opportunity to extend its cull of disabled people that began in 2010 when this government started its austerity drive. And, since then already tens of thousands of disabled people and elders have died because of various cuts to services and support. But now it's been people in such high numbers, we're still not even sure what those numbers are. So that's been my greatest concern. It has been absolute carnage. At the end of this, we will have a percentage of our community that will have died that is phenomenal and frightening. And it's very UK specific. So people talk about eugenics as if it's something that only happens in other places or something that's only happened in the past. But we forget that our history is that the UK scientists here were pioneers in eugenics, and those scientists and their organisation, the Galton Institute, still exist, that we still have eugenic people working here. We have a government that has not supported us to live, and it feels like they've used COVID as an opportunity to extend that cull. And I'm glad I'm going on record saying it. Cull is a strong word, but we're talking about numbers that really you would think should be causing a real stir, but they are not, because we live in a society that has been consistently devaluing, demonizing, monstering, and killing disabled people for a very long time. And people are used to this now. They kind of accept it. These are just some of the things we need to change. How we move forward from here, I don't know, because what has been done to our community was mostly avoidable. Much of this death could have been avoided. And I think we have to realise that the death toll is not a mistake. It's been created this way. And it's because our fight didn't get far enough yet, you know, and they're rolling back rights that we've fought for 50 years in just this element of the modern disabled people's movement. So yeah, COVID-19, it's been carnage. I think that's the only title I could give my video. But at least we need to record this. And we need to avenge this. And we need to make sure that our people are not forgotten. Thanks.